Pretty good. We're back to doing our normal public health work, and that feels really good to be setting new directions to try to meet things other than the communicable disease. So.
Understandably. Now, one of the first things I wanted to ask you was in terms of case trend, what are we seeing locally with influenza, RSV, and COVID?
So none of them do we track numbers any longer. It's all present. We're hearing from our providers and our hospitals and our urgent centers that there is a lot out there. We still are seeing COVID, we're seeing a lot of flu, and we're seeing a lot of RSV. So we got the trifecta going on out there. So there's a lot of viruses spreading around. So people need to be aware of that and take precautions as appropriate.
What are some of those precautions?
Well, the very first thing is to remember the basics, and that's wash your hands. Really hope people got good habits over the last couple of years in doing that. That definitely helps with spread of flu and other viruses and other disease. Think about wearing a mask, especially if you're going to be indoors with a large volume of individuals. I can tell you most people are not wearing masks, but they have to use their own judgment for that.
And in terms of the flu, RSV, and COVID, can you just explain to me what is the difference among the three?
Well, they have very similar symptoms. Upper respiratory. The RSV really hits the very little children because their immune systems are not that developed when they're very young. And there's no vaccine for that at this time. So they're at the most risk. Most people who get RSV will recover very well, but it's the children that are at risk. So you want to be very careful about keeping them safe. In terms of flu and COVID, very similar scenarios to very mild symptoms to very severe symptoms. We still have people that are dying. Every year, people die from flu. And we are still seeing people die from COVID. So most people right now are experiencing mild symptoms from COVID. But again, you don't want to risk it, especially if you have underlying issues.
And how could someone potentially tell the difference between them before a full diagnosis or a test?
You probably really can't. You need to take the test to know which one you have. They definitely have tests for the flu and COVID, and most of the time when you go to your doctor's office, they will test you for both of that. And then if it's not that, they may test you for RSV as well. We also see that in the past, there's more testing being done for RSV, it appears to be this year, just because of the trifecta I was talking about. So they are testing more for it. So that might also be a part of what our numbers are. But again, the hospitals are busy. The urgent care centers are busy. The doctor's offices are busy. So there's a lot. And it's also earlier this year than normal. We don't usually see a lot of flu right before Thanksgiving. It's usually after the holiday mix that we start seeing those numbers start going up. But we did definitely see it earlier this year.
And is one worse than the other two? Like, if you are someone who's elderly, should you be more concerned about contracting RSV versus the flu or COVID, one more than the other?
You know, it's a good question. And I wish there was a pat answer for that, but everyone's immune system is different. So you don't know how you're going to react to any of them, whether you're going to be the one who has the really severe reaction to it and symptoms. But everyone's immune system really is different. That's why it gets a little challenging. And the symptoms are different. Some people will get more of right in their chest and a long, prolonged cough. Some people will get long COVID. I mean, all of these things are very dependent upon your own bottom baseline health.
And I know you talked about that hospitals and urgent cares are busy, but what are you hearing from local hospitals or medical facilities in the region about how they're handling these illnesses?
Well, they're definitely working very hard. One of the challenges is that we're already having throughout the nursing homes and throughout the hospitals and all throughout healthcare, we have a shortage of healthcare workers. And so on top of having an already challenging time, that when one of your staff gets sick and can't come into work, that just compounds the challenge that the hospitals are having.
And so what are your expectations heading into the holiday season, heading through the holiday season? We haven't really had a holiday season yet since the pandemic started that didn't involve a spike of COVID cases, right? So what should we expect with RSV, the flu, and COVID all in the mix?
It's a really good question. At this point, we're really just watching to see if this surge at for the providers continues. And as people gather for the holidays, more and more people get together. They're inside. They're not outside like we were a couple months ago, which is a little less challenging. So, we expect that the numbers will go up to some degree. We're hoping that between the vaccinations and people already having the disease, that they might have some antibodies, and then some people being still very careful, we're hoping for the best.
Yes. And so that being the case, I guess, finally, talk to us about some of the best practices to keep everybody safe and healthy this holiday season.
Well, the very first thing is, if you're sick, stay home. Don't be out there spreading it to everyone under the sun, especially to anyone in your family that might be immunosuppressed or that's older and has some underlying health diseases. So, it used to be that we were tough, so you'd get a cold or you'd get the flu, and the minute you could, you'd go back to work and you'd still be sick and you'd still be able to transmit. And the message really is, please be careful and be thoughtful of others. So it's a double-edged sword about wanting to get to work, but at the same time, trying to keep people safe. So wash those hands, stay home if you're sick, wear your mask if you're really going to be at a very high intense area. We're seeing right now, I can tell you, I volunteered at a festival this past weekend, and the numbers there were amazing, how many people were there. And it's wonderful because we want to get back to having a real Christmas and to be able to enjoy those festivities. But I can tell you, I had my mask on and I didn't stay very long, because it really, once my volunteer piece was over, I usually go and shop a little bit, but the numbers of people that were there were kind of alarming to me. So be careful. Think about where you're going. Think about your risk. Again, stay home if you're sick.
Thank you so much, Mary Beer, Ontario County Public Health Director. We really appreciate you taking the time to help us get the word out. Thank you so much.
Thank you. Happy holidays.